Excellent, good. Well, thank you ever so much for inviting myself along to address this this group. So many thanks to Fact Change Day. Just to introduce myself, my name is Rob Wakefield, and I work for NHS England and Improvement on the Beneficial Changes Network. And I really wanted to use this half an hour as the opportunity to share the journey we've been on this work. Encourage you to engage and get involved with it and answer any questions that you might have. So I've got some slides to talk you through, which explains what the network is, the clues in the title, and also some of the brilliant work that we've harnessed from across NHS England and Improvement in response to from the changes in activity in response to COVID. I'll just dwell on the title. Actually, we're very keen that this isn't a national programme and it's more a network, and there'll be a little bit more around that, around how we stitch that together and work on a network basis. And we came up with the naming convention of beneficial changes because it's all around the positive changes from the responses to COVID, and how we try and ensure as an organisation and as a health system that we hang on to some of that good practice. So first of all, the shared purpose. So I'll leave that on screen, but just to pick out a few key things from there. It's in the black text towards the bottom. The key work of the network has been capturing these benefits, so initially identifying them, providing some evaluation rigour around them and some science to try and distill those down from a massive number of a broad range of changes into higher impact ones. And we're now in the process where we're really keen to share that knowledge and move towards embedding that throughout health and care. So this slide's a little bit difficult to see, but basically the coloured blocks from left to right show the breadth of the work streams that are involved in beneficial changes. So from clinical care, which is largely secondary care, through primary care, mental health, community care on the left-hand side there. But some really interesting work streams and things coming to the fore. For example, how we engage with citizens and public, how this work hooks into other work around culture and people and workforce, right over to the right-hand side there, and the important agendas around green NHS, professional practice, and so on. The lines across the bottom try and demonstrate the sort of cross-cutting themes. One thing to say up front is we've been extremely keen that health inequalities and addressing those are front and centre of this work. It'd be a real shame if we identified beneficial changes which made things worse for certain groups. So we've worked extremely closely with the Health and Wellbeing Alliance, voluntary sector, patient groups, etc. And also, it's fair to say we've engaged extremely extensively with the other arm's length bodies and various other stakeholders. Which brings me on to this next slide. Those of a certain age will recognise the blockbusters dynamic of this slide, but this really brings to life the breadth of the network and the stakeholders involved. And just to focus attention on the right hand side there, again, patient voice, carers, public, but we're really keen to work hand in glove with systems and providers and regions, and we're doing that. And also it's amazing, a lot of the national bodies are carrying out similar kind of networks, similar kind of pieces of work. And some of the stuff I'm going to share with you in a minute shows that a lot of these arm's length bodies and other organisations are all coming to the same conclusions as well, which is good. So the objectives of the network, I'll leave those on screen, but I'll just pick out a few to share with you. First one is capturing the opportunity that COVID-19 has given us to do things differently. I think we'd all acknowledge that we've had to do things differently, but this piece of work is around identifying the beneficial stuff that comes out of the back of that. Second, maximising the groundwell of support within NHSEI and across the NHS. So a lot of what I'm going to share with you today is from frontline clinicians, from patients, patient groups, regions, systems, national teams. It's a real melting pot of good and best practice. So in terms of some of the achievements of the programme, we've engaged with thousands of stakeholders, literally thousands via various different fora and individually. We had over 3,000 beneficial changes identified, the vast majority of those coming from sort of the clinical side of things. So people have been extremely, willing, giving and sharing of their ideas of how things have improved in ways of working in response to COVID, and some of those changes that we can take forward. That's resulted in 170 of these things being properly evaluated with a reasonable amount of science behind it. We've had quarterly sharing events to share where we're at on each of these initiatives. Hundreds of people attending our lunch and learn session. We've got a futures platform, more of which a little bit later on. We publish a fortnightly evidence scan, and we've got a very inclusive fortnightly steering group, which includes people from NICE, CQC, Confed, regional teams, etc., which helps shape the work of the network. So the timeline, this looks a little bit like an Aztec pyramid. If we start at the bottom and work our way up, the stuff I've just described around the gathering of intelligence and the evaluation of it has culminated this month in sharing those outputs with our National Incident Response Board, and they'll be going to the NHSEI main board next month. And then the rest of the year we'll be working through evaluating those high impact beneficial changes and really getting to a granular detail around how we potentially support the spread of those. We've got a multi-agency report where we're hoping to share our work alongside NICE, alongside Confed, CQC, NHS providers, etc. in this space, hopefully before the end of the year. And then for 2021, it's all around supporting systems, supporting organisations and supporting individuals to scale and spread some of this best practice. We're working very closely with the NIHR, Academic Health Science Networks, and the ARCs to add some regional and local flavour and colour to that analysis. And the multi-agency review, as I mentioned, is due later on this year. So I guess probably the most interesting part of the presentation, hopefully, is sharing what some of these beneficial changes are. So on the screen now, there are 5 key areas of shortlist priorities to provide some examples. This is by no means exhaustive, but this is the list that we shared very recently, only last week, with health and wellbeing groups, voluntary sector and patient groups. As you'd imagine, some of these are common to more than one work stream. I'm sure there's been a lot of content already today about the opportunities around remote triage, around video and remote consultations. And certainly, I mean, I've only been in the NHS about 7 or 8 years, but cracking this nut of integrating service delivery and creating new pathways that bring some of this practice to the fore. Staff also extremely important, how we support the health and well-being of our staff, but also how we provide the tools and ways of working. So, for example, virtual passports, ability to flit seamlessly between sites and organisations, access to returners, etc. I'll move on to a little bit of detail around what these shortlisted priorities are by work stream. Again, thinking back to that brightly coloured slide I shared a moment or two ago, what we've worked on the work streams with is to identify, following evaluation, the sort of 5, 6, 7 top ones for each work stream. I'm sorry this slide's a little bit uneasy on the eye, largely because some of the content in it is bold, and the bold content identifies that these are beneficial changes that impact more than one work stream and are relevant to more than one work stream. So if we were to look at clinical change there, things like remote monitoring, integration of service delivery, upskilling of staff aren't just clinical change beneficial changes, they're also relevant in many of these other work streams. Just moving on a little bit, obviously there's quite a lot there in digital, which is a standalone work stream. People and culture, we were very pleased to, early on in the process of the network, inform some of the content of the people plan with this material. And as we move into some of those other work streams, you'll see the balance becomes a little bit more non-bold text. So things that are specific for ambulance, for example, professional medical practice, community care, estates, and so on. We're more than happy to share these slides afterwards, by the way. I'm more than happy to make them available via the network. So just to dive into a little bit more detail, we'll take a quick look at clinical and service. This slide pulls out some of the examples. So you can see on the screen there, there's some examples from various health systems, things like drive-through testing, chemotherapy buses, home-based treatments for renal dialysis, video consultations between clinical teams. So behind that massive list I've just shared with you, there are many, many examples, and we're aiming to get case studies shared and published alongside the systems whose work this is. We're not taking credit for it, we're more networking, bringing it together, making this stuff available. Another example around system and partnerships, some really good stuff on the screen there about systems to ask a medical registrar, for example, Southwest London and the input of CSUs in helping to triangulate shielded patient data, and all of which are great examples of collaboration and communication at a system level, which very much chimes with the system by default approach, which is now a key priority for the organisation. I'll just move through those slides and talk about for a moment how you can engage and stay in touch with the work of the network. We've got the Futures platform. If anybody would like access to the Futures platform, it looks a little bit like the right-hand side of this page. That's where all the narratives are shared. It's where all the case studies are shared, links to useful information, etc. And we're just in the process of moving all that content into key themes. It's a really sort of vibrant network of 500 plus people from all professions, all levels of seniority within the health system who are interested in this work. So please do drop us a line at england.improvementsupporthub.pmo@nhs.net. Sorry, I know that's a little bit of a mouthful. And then once you've got access to that, that will feed relevant content into your inbox, and you can explore all the wonderful breadth of work from this program. We've also got a Twitter hashtag. We stay clear of setting up our own Twitter account, primarily because this is a network and draws together and analyzes and shares the work of other work streams. But the hashtag beneficial changes is well worth a follow. If you're enjoying what you're hearing, you're also more than welcome to follow me on Twitter, and that's NHS_Rob. Just in the middle of that page, we've just set up our web area on the NHS England website, which is relatively light at the moment, but there'll be a lot more content coming on there as well. So please do have a look at that. And as it's World Evidence Day this week, I would also encourage you to have a look at our wonderful evidence scan. What we do is pop down and summarise all the available evidence around beneficial changes, not just from NHSEI, but from other organisations, think tanks, academia, etc. And we produce a really snappy 2-minute summary of that, and you can request access to the full version as well. So it's a really good sharing mechanism of everything that's happening in that evidence world. We've literally just published our fortnightly one yesterday to coincide with today's World Evidence Day. So we'd also be really pleased if you could take a look at that as well. So that's it in terms of formal content from me. I have got a few more slides if there aren't anything much in the way of questions. But please do ask us anything. I hope that's been a useful introduction, and more than happy to take any questions on what you've heard about the network so far. I'm not sure whether that's a good thing that there are no questions or not. Excellent. So we've just had a question about patient voice, which is I'm really glad you've asked, to be honest, because I packed a few spare slides just in case we needed to talk to this. But we've worked very closely with the relevant team, David McNally's group and Neil Churchill's area in NHS England and Improvement, and that's given us wonderful access to both patient voice and to health and wellbeing organisations. So David's been at the table throughout the development of the programme, and we've also worked very closely to co-produce everything that we've just shared with you with both patient groups and health and wellbeing alliances. Just to give you a flavour for that, we had it's a terrible word, but we had a triangulation session to share those key priorities with patient groups and representatives a couple of weeks back. People with lived experience, people with certain conditions who were happy to comment on it, and that gave us some real insight into how we explain, how we pitch, how we share and implement some of this stuff in future. If we just take the example of digital, if you work in the centre, NHS England, it seems relatively sensible that where people have got access to digital, that we try and encourage the use of that. But it's only when we started sharing some of this stuff with patients that we scratched beneath the surface and looked at the cost of that. If people don't have data in a mobile contract, it can become extremely expensive to join a Zoom call with a doctor, for example. Some people aren't going to be digital literate and may never be. So I think that really helped us understand that something that we get excited about as a network and as a central team, like for example remote consultations, are never going to be something that's appropriate for 100% of patients. So yeah, it's been front and centre. We've received some very good feedback from patient groups and Health and Wellbeing Alliance members about the efforts we've gone to make sure we've engaged, shared, and before we reported up through our governance channels on those shortlisted priorities, they were socialised very extensively with both patient and health and wellbeing groups. Thank you for that. Any more questions? What does everyone think? Does anyone think we're missing anything or any concerns, or do you think that sounds like a welcome advance for NHS England and Improvement working in this way? It's certainly an interesting project to work on from the team's perspective. Social care, that's another question that's just come in. Interestingly, what we've sort of been challenged and had a interesting conversation around social care. We're extremely keen to, hence the multi-agency work that I mentioned, draw in as wider coverage as possible. And we were conscious when it came to shortlisting the priorities literally over the last week or two that we are a little bit light on the social care side. We have presented to both Solace, that's the organisation of local authority chief execs, and to LGA in the past. And we've also engaged quite heavily through the ICS leaders group. But one thing we're committed to doing over the next week or two is having some follow-up conversations with LGA, not just around social care, but around all the other good stuff that's happening in the local authority space, around bringing communities together and wider determinants of health and so on. So by the time we do publish the sort of end of year report on this stuff, we're very keen that we'll get social care more profile in this work as well. At the moment, it exists in some of the work streams, as you'd expect, around things like discharge to assess, but we'd very much like the coloured pillars that we showed you earlier to include social care too. Next question is around community. We've got a standalone work stream on community provision, which was one of the coloured ones I showed on the screen a little bit earlier. That's again been quite a
interesting journey in that the team responsible for that have reached out to community providers and people working in community providers to identify their own beneficial changes. A lot of what we've gathered so far, this was the same for clinical, it was the same for primary care, same for community. There's been very much harvest from clinicians, managers, people working on the front line. So yeah, there's been a lot of reaching out into that community space and prioritisation of five or six objectives there. In fact, if it's helpful from a community perspective, the key themes that came out from that work stream were virtual patient contact and what would pathways potentially look like in future, and where could people who would potentially have bounced into acute care now be dealt with closer to home. The second key theme was patient focus, which is the increased involvement of patients and carers in self-assessment and self-management. The third was role extension, so changes in thresholds to work with increasing patient complexity, time taken to care, etc. And the work in between bit, which is a common theme about removal of organisational and professional boundaries, allowing increased multidisciplinary teams and multi-sector work. So they were the key aspects that came forward from the community work. And we've got a question from Lou. How did you manage to build bridges across so many networks? Is there a structure where we could build on that in other areas? Yeah, it's. I think I sort of hinted that this is a very different way of working for NHSE and I in terms of pulling together all this stuff as a network. Ordinarily, those 16 work streams that I shared earlier would probably do their own thing, contact system 16 times, patient group 16 times, health and wellbeing alliances 16 different times. I think the real benefit of working on a network basis is we've done quite a lot of the heavy lifting, the facilitating there, which has been great. We're also very, very keen, to Lou's question, to share a little bit more about the beneficial changes journey and the way that we've done all this. So it has involved a massive amount of stakeholder management. There are existing forums that it's been possible to hook into. So for example, HR Directors Network, Improvement Directors Network, regional team meetings, etc., etc. But yeah, one of the things I'm personally really keen to do is share a little bit more around how we've managed to do that and how we've managed to maintain that level of engagement throughout. I don't think it's anything that there's a playbook written down for. I suppose we're fortunate in that a lot of the people we've engaged with are also interested in parallel streams of work. But yeah, it's been good. Yes, I certainly can share the process on Fab NHS stuff. We're hoping to knock together a quick video and a case study as well. So more than happy to share it via any network where it's going to get seen. I don't think I've missed any questions. Let me just have a little scroll through. So we had social care. Jodie's mentioned where the futures platform and the evidence scan, community hospitals we've discussed, and my patient voice we've discussed, and my microphone was a bit shaky earlier on. Sorry about that. Okay, more than happy to take any questions, or we can draw it to a close a minute or two early. Okay, let's draw it to a close there. So many thanks for everybody who's joined this conversation. Please do engage with us going forward. If you've got any questions for me afterwards, relating to this and the work. I'm just popping my email address in the chat bar. Let me just make sure that's for everyone. And thanks again to the Fact Change team for inviting us along. It's been really, really great to be able to share the work of the network and share some of the exciting activity that's going on. Thank you.
Thanks ever so much, Rob. This is Lou. Thanks ever so much for coming, and to Jodie as well. It's been really interesting to hear, and I do recommend that anyone in the session does join the network. I'm on the Future platform, and there's so many great shares and opportunities and fabulous information that comes out all the time. So really recommend joining that if you get the opportunity. Thanks very much.